Hello, welcome once again to medical student, second year in the College of Medicine and College of Pharmacy, whom join us in this series of lecture in a physiology of cardiovascular systems. We study in the previous lectures and the basic principles and the fundamental and essential of electrocardiography. Today we will continue in the few words about what a normal sinus rhythm, as we discussed in the previous lecture, and some sort of arrhythmias. This is every ECG, as we know from previous lectures. We have to calculate the rate, determine the regularities, if it's regular or not regular, by distance between RR waves, and every QRS complex preceded by P wave, and then to assess the P wave equilike and the distance between P wave and P wave it's regular, and determine PR interval duration is normally 3 to 5 small boxes, and determine QRS complex shape and the duration, which is 2 to 3 small boxes. So the criteria of the parameters of normal sinus rhythm is the rate between 60 to the 100 beat per minute. It's irregularly, and the normal P wave, and the PR interval between 3 to 5 small square or box, and QRS duration between 1 to the 3 small boxes. So this is what called normal sinus rhythm. Any deviations, any change in these essential parameters, which called arrhythmias or dysrhythmias. If it's sinus rhythm but it's rapid, called the sinus tachycardia. If it's the same criteria but the rate below 60, called sinus bradycardia. So look to that, the P wave, QRS complex, the RR wave is equidistance. The rate, as we said, from 1, 2, 3, 4, 300 of 475, and the few small square with 75%. Rhythm is regular, and P waves equal shape. Every P wave followed by QRS complex duration is normal. This is the criteria of normal sinus rhythm. What mean by normal sinus rhythm is a sinus node, the origin in a sinus node, and follow normal conductive system in the interatrial conducting systems, and then to the AV node, then bundle office, then the bundle branch to the Purkinje systems. So electrical normal sinus rhythm, electrical impulse is formed in SA node, natural pacemaker of the heart, and conducted normally. This is a normal rhythm of the heart. Other arrhythmia that don't conduct via the typical pathways are called arrhythmias or dysrhythmias. So any change from this normal sinus rhythm called dysrhythmias. This is again ECG sample, and the P wave, a rate about this is the rate 1, 2, 3, something about the 70 beat per minute, and every P wave QRS complex, RR equidistance, normal PR interval, normal QRS complex in shape, and the duration. So this is normal sinus rhythm again. In a normal sinus rhythm, usually look to the lead 2 of the 12 conventional lead, and in lead 2 this P wave upward, in AVR this downward. In normal sinus rhythm, this is a 12 lead ECG. Usually we do lead 2 for the rhythm analysis with the ECG. This 12 lead 1, lead 2, lead 3, AVR, AVL, AVF, bipolar, unipolar, and chest lead V1 to that the V6. So this lead to for rhythm analysis. So the rate in this about the 75 beats per minute, normal P wave, normal QRS complex duration and shape, RR waves are the equal, so this is the ECG of normal sinus rhythm. This is the standardizations for the voltage. If it's low, called that the low voltage. If it's high, called high voltage. This is where isoelectric line, and this is standardization in every ECG machine gives standardization for that the voltage. So the arrhythmias, I mean deviation from normal sinus rhythm, the disease or the problem in either SA node or atrial cell or junctional cell, AV junction, or ventricular cell. This has become the dominant over the SA node, so abnormality there, and it might produce dysrhythmias. Come to the first two things is the common sinus bradycardia and sinus tachycardia. What mean by that? The sinus node can fire too slow, otherwise all the criteria of normal sinus rhythm is called sinus bradycardia, or fire too fast, called sinus, but it is that the sinus tachycardia. As we know, the SA node is spontaneously discharged, not affected by it needs no stimulus from CNS, while the CNS autonomic nervous system either accelerate or decelerate, either cardio inhibitory or cardio acceleratory, as we know. So sinus bradycardia is the too slow, while sinus bradycardia too slow, while sinus tachycardia is too rapid. Look to this ECG. If we calculate the rate, it nearly 1, 2, 3, 4, 5 into 8, about 30 beats per minute. Regularity, it's irregular. Yes, the distance there, equal distance there. Every P wave is followed by a QRS complex. Is the P wave normal? Yes, look alike, and that is normal. PR interval is a normal, 3 small square to reach about that the 4 small square. While QRS complex normal duration, 1.5, about 10 seconds. And so interpretation, this is a sinus, but the problem, we know the sinus between 60 to 100, this is a 30. So it's sinus, but too slow, so it's called sinus bradycardia. This is a sinus, but bradycardia. The sinus deviation from normal sinus rhythm, yes. Rate is less than all sinus bradycardia when diagnosed. If the rate below 60, and that the other criteria is a sinus rhythm. Sinus node is depolarized slower than normal. Impulse is conducted normally because it is everything is normal, but the impulse is initiated in the slow rate, which is called the rate of the sinus bradycardia between 40 to 95, even less than 40. P wave is sinus normal, QRS normal, conduction normal, and the rhythm is regular. All these criteria is called sinus bradycardia. This rhythm is often seen normally sometimes in athletic people and the physical fit, during sleep, or in response to vagal maneuver, or in some disease that lead to the sinus bradycardia. If we look to the strip ECG, found the rate 1, 2, 3, 4, 5, 6, 7, 8, 8 something, about 35. P wave QRS complex, PR normal, QRS complex normal, equidistance between RR, so it is normal sinus rhythm, but slow rate, so it is sinus bradycardia. Look to this rhythm. The rate is about 130. Calculate 1, 2, 3. If it's 3, 100, and the 2, 150, about 2 beats there, 2 small squares, so 130 beats per minute. Regular, yes, it's look like regular. And P wave is normal in shape, and that it is preceded the QRS complex. Duration of PR interval is normal, and duration of QRS complex and shape is normal. So it is normal, it's sinus rhythm, but the rate is rapid, fast. So it is called sinus, but tachycardia is rapid rate, sinus tachycardia. Sinus tachycardia is deviation from normal sinus rhythm. Yes, it's arrhythmias. Rate more than 100. We found ECG strip more than 100, and it's regular, P wave normal, QRS complex, so it's sinus tachycardia. ا.م.d is depolarizing but faster than normal. Impulse conducted normal. Remember, sinus tachycardia is a response to physical, exertional, psychological, and that it's not so primary arrhythmias. So if the rate between more than 100 to 160, P wave normal, QRS normal, conduction normal, regular, this is called sinus tachycardia. Sinus tachycardia could be found in a low to condition, as we say that the stress, psychological, and the heart failure, hypoxia, pulmonary embolism, increased fever, increased temperature, stress, response to the pain, and so on. This ECG, the rate is about 120, and that the P wave QRS complex are the same distance, normal PR, normal QRS complex, so it is sinus, but tachycardia, sinus tachycardia. So we come to the new topics, is that the premature atrial contraction and the premature ventricular contractions are called premature atrial beats or premature ventricular beats. Look to this ECG. The rate is 70 beats per minute. If we calculate 1, 2, 3, 4, and the small square, so 75, 300 over 4, but 5 minus, so it is 70 beats per minute. Regular, it's regular there, but the beat number 7 and beat number 2, it's irregular. Occasionally irregular, and the regularity is irregular. So this is that the P wave, and this is ectopic, and this is that the beat does not look alike these. And the P wave normal there, normal there, normal there, but it's different in the P2 and P7. So 2 and 7 different contour. This is a P wave. This is a P wave different from this normal P wave. And that the PR interval, we can measure it normal there, normal there, normal there, but that there we can't measure it really. Except 2, 7, so it is that the about 3 small square. QRS duration look normal in all these leads, even these ectopics are the same, all the QRS complex. Only different is the P wave and PR interval. So interpretation, this is normal sinus rhythm with the premature atrial contractions or beats. We know this beat and this is beat normal, this is normal sinus. We don't expect it there an ectopic I beat, but it's coming, so it is a prematurely. And the P wave is different, so it is not originated in SI nodes, originated in the atria. But past normal because the QRS complex and down is normal. So it's ectopic, originated in atria, not in sinus, come prematurely and followed by a short pause, what called compensatory pause, before next normal sinus beats. So this is what called premature atrial contraction. Why atrial? P wave is not like a sinus. QRS complex normal. From atria down is normal conduction. from the SA node to atria, it's abnormal. No SA node, I mean normal impulse coming there from the atria, which is called premature atrial contraction. This is a beat 2 and beat 7. And these ectopic beats originate in atria, but not in SA node. Therefore, the contour shape of P wave, the PR interval, and timing are different. Coming earlier, contour different, PR difficult to be measured there. And the timing also, it's coming premature. And normally generated pulse from normal generated pulse of SA node. So it is premature, coming earlier, atrial because the P wave is not normal, contractions or beats. QRS complex is normal. Excitation of an atrial cell forms an impulse that is then conducted normally through the AV nodes, ventricle. This is that the P wave QRS complex, P wave we doesn't expect it to be there, but it's coming earlier. There is no P wave, or PR cannot measure it, then a compensatory pause, a period of compensation, and then sinus, then ectopic. So what is called premature atrial contractions. The premature atrial contractions can find it normally and need not any sort of treatment. Please pay attention. When an impulse originated in anywhere in the atria, anywhere in an SA node, atrial cell, IV node, bundle of His, and then is conducted normally through the ventricle, QRS complex is normal. Again, any impulse originated SA node, or atria, or AV node, or bundle of His above. This also, it's not sinus, atria not sinus, AV sinus, but then conducted normally, so QRS complex is narrow and normal, like in the premature atrial contraction. While if the impulse originated in a ventricle, so QRS complex will be bizarre in shape and duration, abnormal. Look to this ECG. The rate is that the 60 beat per minute, 5 small square, big square, big boxes, 300 over 5 is 60 beat per minute. Regularity is regular except this beat, occasionally irregular. And P wave is normal except in this beat, none of the 7 QRS complex. And the PR interval, we can measure it normal, but we cannot measure in this beat. QRS duration is normal and shape, but it is different in this beat. So what does mean that? It means that sinus rhythm, but with one premature ventricular ectopic or contraction. Why ventricular? Because the QRS complex is a different shape from normal. As we said, if the impulse originated SA node, atria, AV node, bundle of His above, the QRS complex will be normal. But if in the ventricle, QRS complex is look abnormal, and T wave is in opposite direction. This is a T wave, this is a T wave. In the ventricular ectopic, the T wave in opposite direction of R wave. R wave down, it's upward there. This is called premature ventricular contractions. Why it's a premature? We doesn't expect it to be there, but coming prematurely. So this is that the premature ventricular contraction. Ectopic beats originated in a ventricle, resulting in wide and bizarre shaped QRS complexes. When there are more than one premature beat and look alike, they are called uniform. When they are look different, they are called multiform or multifocal. This is unifocal, it's originated from one focus. if it's multiform or multifocus. This is the sinus rhythm, but this is abnormal beats and this is abnormal beat. And this is come prematurely wide bizarre QRS complex and compensatory pulse. And then other ectopic, which is a prematurely different contour from this ectopic, that this is a multifocal and different multiforms. And so it is multifocal premature ventricular contractions or beats. And one or more ventricular cells depolarize there, and the impulses are abnormally conducted through the ventricle. Again, you have to pay attention. When an impulse originated in a ventricle, conduction through ventricle will be inefficient, and the QRS complex will be wide and bizarre in shape. This is the ectopic originated in a ventricle in different foci, so it's multifocus or multiform. So ventricular conduction, if a normal signal move rapidly through the ventricle, that's why it's normal QRS complex. If it's abnormal, any impulse there in the atria, SA node, AV node, bundle office, give normal QRS complex, narrow QRS complex. But if the origin signal moves slowly through ventricle, if the origin in ventricle folks move slowly, give depolarization is the wide and bizarre or abnormal shape of the QRS complex. And this is the ectopic, different from this ectopic and from this ectopic. So it's multifocal, multiform. Why ventricular ectopic? Because the QRS complex is normal and T wave in opposite direction. T wave in opposite direction of R wave. And it's followed by the compensatory pulse. This compensatory pulse is called complete. If we measure R wave between this ectopic R there, so it is double the value of preceding R wave. It's not need to know this, this fact in this stage, but it's called compensatory pulse, enough for you. And this ECG, this is ectopic, and this ectopic uniform from the same origin, ventricular, because QRS complex is the wide bizarre and R wave in opposite direction of ST and T wave, and they come earlier and come premature. See you soon in the next lecture.